So the scale study was conducted in urban settings in 2 middle-income countries of the Middle East and North Africa region, Beirut, Lebanon in the Eastern Mediterranean, and Tunis, Tunisia in the Southern Mediterranean. In both of these contexts, in the last 2 decades, we've seen substantial dietary and lifestyle changes, leading to a doubling of the prevalence of overweight and obesity among children during this period. When we first set out to conduct this study, the estimates that we had available for the prevalence of overweight and obesity in school-age children were of around 20% in Tunisia and 30% in Beirut. And in school-age children, adolescents, both school and neighborhood environments constitute intermediate structures which can mediate the effect of societal forces on children's food choices and habits. And so what the research team set out to do was to develop innovative and context-specific methods that would allow us to measure and account for the very complex factors that influence children's food choices and their diets, to describe the environments in which these choices are made, and identify barriers and enablers to these to healthy choices in school environments and surrounding neighborhoods. And ultimately, we hope that this research will inform context-specific multi-level interventions to influence children's food choices and their diets. So in order to do this, we considered factors at the macro level, such as the economic and policy environment, which we heard about last week in our first webinar. And then meso-level environments, which include school food environments, the wider food neighborhood that children encounter in their daily trajectories, and then factors at the household and individual level. And from a methodological perspective, we prioritized, as I said, the development of context-relevant measures and really aim to engage with children's lived experience of their food environments. So at the macro level, we relied on desk reviews and secondary data analyses. At the meso level, we conducted school surveys and checklists. We also developed a wearable camera protocol to map children's food exposures in their daily trajectories and used machine learning to conduct photo analysis. And we'll be hearing from Dr. Shadi Al-Basyouni today on this component of the study. We also conducted geospatial mapping of food outlets and advertising around schools to estimate exposures within school neighborhoods, and we'll be hearing from Christelle Ael about this today. And then at the micro level, we conducted surveys with children and parents, as well as a gamified choice experiment, which we heard about last week in our webinar. So throughout this webinar series, we're presenting data that were collected to represent 4th to 6th grade children and adolescents living in urban contexts in both Lebanon and Tunisia. We used a 2-stage sampling approach to recruit a representative sample of these grades, the majority of whom were aged between 9 and 12 years, attending approximately 50 schools in each city. Schools were stratified by school type and then randomly selected using probability to proportionate to size. And then within schools, children were stratified by grade and then a random sample selected within schools. So the data that will be presented today and in this whole webinar series relies on this sample of almost between 2,000 and 2,500 children, their parents, some images that we'll be seeing today from wearable cameras, as well as data from over 3,000 retailers in each context and over 2,000 advertisements in each of these contexts. This is our second webinar of the series, and in each of our webinars, we're aiming to have presentations of around 20 to 25 minutes each and leave 25 minutes for an open discussion. During this discussion, we would very much value hearing from the audience about similar ongoing work in other contexts, thinking about parallels and differences, and really considering together what the next important research questions are as relates to children and adolescents' food environments, their choices, and their diets. And I also want to say that everything that is being presented during this series is really the result of an amazing team effort involving incredibly dedicated teams in both Lebanon and Tunisia, and we're very grateful to everybody who is part of the team. And for now, it gives me great pleasure to introduce our speakers for today's webinar. So the first part of the webinar will be presented by Ms. Christelle Ael, Christelle holds an MS in nutrition and is currently pursuing her PhD degree in epidemiology at the American University of Beirut. She has over 8 years of experience in public health research, mainly focusing on dietary assessment and measuring food environments and looking at associations between these exposures and nutritional outcomes and non-communicable diseases in the Arab region. And then the second part of our webinar will be presented by Dr. Shadi El-Basyouni, who is an associate professor at the Computer Science Department at AUB. And Shadi's research focuses on information retrieval, crowdsourcing, and machine learning applications, particularly deep learning in various domains, including natural language processing, computer vision, public health, and medicine. He holds an MS and PhD degrees from the Max Planck Institute for Informatics and Saarland University in Germany. So I will give the floor to Christelle to start with her presentation. Thank you all.